Hi, this is Michael Rath. I'd like to talk to you for a short time about serotonin overload, specifically serotonin syndrome. We have many patients coming to our clinics with quite a broad array of different ailments, and most of the time we know exactly what to do, what to give them way of supplements, herbs, the diet that we're going to be putting them on, lifestyle changes that we're going to be having them make. But every now and again along comes a client with a condition that makes us reevaluate what we are doing, or not so much the condition but their reaction to our treatment. Now, Jane is just one of those types of clients, and the reason I'm speaking to you about this is because it's the first time I've come across it in all the years I've been working with neurotransmitters and mood disorder, and so it does need to be discussed and what precautions can be taken from preventing it from happening with one of your clients. So I begin with a naturopath being visited by a new patient. We call her Jane. Its names have been changed to protect. She had a few health challenges, including things such as fibromyalgia, tiredness, and was also taking Effexor for depression. As well as wanting a treatment for her various conditions, she also wanted to get off the Effexor. The naturopath recommended that Jane take one of the 5-HTP, 100 milligram, and one of activated B3 capsules a day. She took the capsules as recommended that night and woke up the next morning with a major reaction taking place. The symptoms that she was experiencing were severe and extremely stressful. Jane called me later that day and told me of what had occurred, and upon evaluation they seemed to be a combination of serotonin syndrome coupled with panic attack, stuck on for good measure. The serotonin syndrome was the heart of the problem. I gave some advice and suggested that she also visit the emergency department of a local hospital to get checked out. Now, when these things were first occurring, Jane had a hand on the phone. She was going to call an ambulance and go to the hospital, but she changed her mind at that stage. I asked Jane to write up what she'd experienced and to send me the information via an email. In her email, Jane said, at 7 p.m. in the evening she took a 5-HTP, and around about an hour later she took an activated B3. The next morning she awoke and had a feeling in her head that she had missed her daily dose of Effexor, because the effects of running low on Effexor happened fairly fast. It's only got about a 6 to 12 hour half-life, so if you go for an entire day you're actually starting to go into serotonin withdrawal syndrome. And she felt very fuzzy in the head. That lasted about 20 seconds, and then her breathing became difficult. She realised she wasn't getting enough oxygen, so she got out of bed, and she felt as though she was going to die. She knew she was starting to feel faint from a lack of oxygen. She took a pulse and was so fast that she couldn't count it properly, and lost count at 150 beats per minute. So it was over and above that. She walked around a bit in the cold air, seemed to revive her. Because she couldn't get a proper pulse, she got a blood pressure machine and put that on. And the BP was higher than the machine was capable of reading, so the machine didn't register the BP. She sat in the bed for a while as she was feeling unwell, and when she finally checked the BP again, it was down to 153/87. The same thing happened again 2 or 3 more times, and during the second episode, which was about 3/4 hours later, she had to get out of bed and move around again, but it wasn't as severe as the first time. The next few times it happened, it was mild compared to the first, and she didn't get out of bed. Her pulse rate was about 100 for the rest of the day, and her chest was sore throughout the day. She also felt very weak and had heaps of the fibromyalgia pain. I gave her some advice, and in fact I asked her to take some bicarb soda and a large amount of water. The reason for that was to reduce the circulating lactic acid concentration and to reduce lactic acid doses. That also would reduce the feelings of panic and severe anxiety. This feeling of not being able to breathe and having to move, that's quite classically common with a severe panic attack. And usually it happens in somebody who's genetically sensitive to the elevated lactic acid levels. But in the case of what she experienced, goodness knows what levels they got to as a result of the serotonin syndrome. And to give you an idea what we're talking about, here are some of the symptoms common with serotonin overload syndrome. Mydriasis, that's where you have very wide pupils, enlarged, and they remain so for quite a long period of time. Sweating, diaphoresis, agitation, increased bowel sounds, diarrhea. That's the serotonin really stirring the gut and bowel up. tachycardia, heart was racing and pounding, as she mentioned, autonomic instability. This can mean that the pulse can be irregular. Often the pressure is very high, as she found out. Clonus, this is a condition where the muscles are contracting and they're doing it on a sort of regular basis. You can also have tremors as well. She wasn't doing very well at all, and it was quite serious. And I said, if that ever happens to you ever again, call 000 and go straight to hospital. In fact, you should have done it again that evening, as I'll explain why. And I received this email on the day after, and she said, I didn't go to hospital last night. I did go to hospital last night as you requested. I told them that all that happened, that it was serotonin syndrome. Maybe I shouldn't have said to her to tell them that. I should have just said that you had chest pain and let them take it from there. She was waiting there for a couple of hours and she still hadn't seen a doctor. So obviously the triage nurse didn't pick up on what the heck she was saying, which was pretty darn stupid. And that's not unusual, she says here, for our useless A&E department. She had a lot of muscle pain and she was sick of sitting there not getting anywhere, so she went home. And she said, I'm okay this morning, the pain is certainly lessened, thankfully. Seeing my GP tomorrow, so I'll tell him what happened, and thank you for your help and concern. I had said to Jane as well that yesterday, or the day before, I said to her, stop taking the 5-HTP immediately, and what we'll do after a few days, we'll give you some activated B3, and that should help to produce all things like serotonin, dopamine, noradrenaline and GABA, but it shouldn't do it anywhere near as actively as what the 5-HTP did, and so it should be fairly fine for you. And here we have a couple of days later. Hi Michael, you're not going to believe what happened yesterday morning. As we discussed, I waited 2 days and took no supplements. Then on Saturday night I took half a capsule of activated B3. I was fine, so I did the same on Sunday night. But at 6 AM the next morning I got up to go to the loo and was absolutely fine. When I got back into bed and lay down, the same scenario started to happen again. And she said, luckily my husband was having the day off, so he was there to help. It was frightening, as was the first time, but not as severe. The symptoms were only half as bad. But by the time bedtime came last night, I was in a panic, despite not taking any more NAD, activated B3. I was actually too scared to go to bed and got myself into a right state, which is not like me usually. But it was such a frightening episode that I definitely didn't want it to happen again. Anyway, I finally went to sleep and all was well. No more NAD for me either. Now, the problem with Jane was that when she filled out the neurograph questionnaire, there's a couple of areas that were marked that weren't really picked up on. I hadn't thought a great deal about it myself, because having gone through major depression and on massive doses of drugs and then taking things like 5-HTP and semi and activated B3, etc., I had no problems whatsoever. But I'm at the exact opposite end of the scale to what Jane was. In her case, when she filled out her questionnaires, she mentioned on there, first of all, of course, she was taking an antidepressant, and secondly, that she is sensitive to medicines, drugs and chemicals. And it's that combination which wasn't picked up either by the naturopath or by myself when I subsequently spoke to Jane. I hadn't actually seen the questionnaire, so possibly I should have asked, whether she was sensitive. So that is a major problem that needs to be considered. Anybody like that. And so what I've now done with the later version of the program, I've now got alarms in there. So if somebody tags that they're taking antidepressants, and they also have tagged that they're chemical and drug and medicine sensitive, it'll bring up a big flag saying do not recommend 5-HTP and activated B3. And instead, what is much better off to do is to improve, in her case, clearance of things like the drugs, like effects, or the reason why she's so sensitive is she's not clearing things like she should. First stage clearance, cytochrome enzymes. So if we can do something to improve that clearance, she won't be in such a state in future. And in fact, it should help her in many different levels. So we need to improve stage 1 detox. It may be functioning at a lower level due to genetic variations or polymorphisms, not uncommon. And antidepressants themselves can have an effect upon the detox enzymes and interfere with their function and their production. Things such as use of alcohol or other interacting drugs can be a problem as well. First stage detox, cytochrome P450s can be either stimulated by or inhibited by various substances such as antibiotics, anticonvulsants, antidepressants, antifungals, antipsychotics, H2 blockers, drugs that are used to reduce gastric acidity. Grapefruit and grapefruit juice are known to interfere with cytochrome P450 function. Some herbal medicines, alcohol, drugs. And with alcohol, you've got many medications can interact with alcohol, altering the metabolism and or the effects of the alcohol and medication. Some of these interactions can even occur at moderate drinking levels and result in problems for the drinker. There are two kinds of major reactions between alcohol and medication. One is what's known as pharmacokinetic interactions, in which the alcohol interferes with the metabolism of the medication, which can result in either a slower or faster breakdown of the drug. Secondly, pharmacodynamic interactions, in which the alcohol enhances the effect of the medication, particularly in the central nervous system, such as a drug that produces sedation. It'll make it have a bigger effect on sedation. So with people such as Jane, with higher levels of activity of an antidepressant due to its slow breakdown because of a compromised stage 1 detox, you're going to get high levels of serotonin, and the potential for serotonin overload or syndrome is very real. So when introducing nutrients that boost serotonin production or serotonin levels in the nerve junctions, be careful. Nutrients such as 5-hydroxytryptophan, NAD or nicotinamide adenine dinucleotide activated B3 for short. Neuroenhance containing things like saffron and St. John's wort, etc. And also the SAD powder. This is why you need to be really careful with these clients, and this is why I'm letting you know about this. You're not going to come across it very often, but somebody somewhere will come across this again. As I mentioned before, part of Jane's reaction was elevated levels of lactic acid, and in sensitive individuals this can trigger severe panic attacks, and that results of course in a much higher release of adrenaline. As adrenaline levels go up, pulse rate increases further, blood pressure goes up more, and so it only worsens the underlying condition of the serotonin syndrome and the effect that the serotonin has on the heart as the fear, fight, flight reaction kicks in. And as I mentioned earlier, her panic attack symptoms included pounding accelerated heart rate, some of it due to the serotonin overload, and other due to the lactic acid triggering the adrenaline release. Feeling as though she can't get enough breath. This is not due from a lack of oxygen, but in fact a lack of carbon dioxide, which helps to balance the functioning of the respiratory system. Unable to keep still, having to get out of bed and walk, felt better when she was walking. This is due to helping to mobilize and clear the lactic acid. Having experienced panic attacks myself, that's exactly what you want to do. You can't keep still. You're very agitated. You've got to move. And as mentioned before, the quickest way to reduce a panic attack is increase water intake to dilute the lactic acid and neutralize it with an alkalizing drink. We can use, of course, a gastric buffer, which is a nice balanced form, or in emergency just grab some bicarb. So half to 1 level teaspoon of bicarb in 500 to 700 mils of water and drink immediately. You may need to drink get up to 1.5 to 2 litres of water over a couple of hours to get the best result. And here's an example of the changes that I've made on the Neurograph program. It brings up this great big box down the bottom, important note, and also it highlights the questions as you're entering them that are related to what we're talking about here. Here we have an overview of the Neurograph, and to the right of that we have an overview of the health graph. It's important to look at that health graph overview to see what's happening with things such as hormones, the gut, and so forth, which will in turn have a very profound effect upon the neurotransmitters. And of course you can see that we have that important note on the bottom to catch our attention. Okay, now let's look at a revised nutritional program for a client such as this. So what we would do to start them on half of a longevity tablet once daily for a week, and then increase it to a half a tablet twice a day, half morning and night. Reason for that is, as well as having a good mixture of your B vitamins and antioxidants, etc., it has something that we really need plenty of, and that is biotin. And 1 milligram of biotin per day helps to increase the production of our cytochrome P450 enzymes, and that's very important to help to clear chemicals and drugs, etc., at a more reasonable pace. After about 4 weeks of being on the longevity, then we can try bringing in 1/4 teaspoon of the SAD powder half an hour before breakfast in either water or juice, and that gives us a very small amount of tryptophan. The beauty of using tryptophan as opposed to using 5-hydroxytryptophan is that with tryptophan it's got to get converted to 5-hydroxytryptophan to do its job, and there's an enzyme involved in that process. That enzyme is rate limited, so in other words, if you have enough serotonin pumping around the system, you won't convert more tryptophan into 5-hydroxytryptophan, which is much more effective and safer for clients such as this, because if you use 5-hydroxytryptophan, whatever goes in gets converted. So it's a really good way of preventing this overload problem from occurring. And of course, don't forget the basics. Get the gut working properly, get the good bacteria working, put in some soluble fibre. All this is important to help gut function and detoxification, as we know. Increase magnesium and also the humble old fish oils. And that about covers it. And it's clients like this who really teach us things that we need to know about clinical practice. You can be in practice for years and years and years, and something can happen like this which really makes you sit back and realise, no, you don't know it all. There's always more to learn. And this type of reaction is often classed as idiosyncratic, and quite a few people, both in Australia and America and other countries, die every year from an idiosyncratic reaction to drugs. A drug can be given to the right person at the right dose for the right condition, all the boxes are ticked, and it can kill them. And in fact, there's quite a few thousand die in America. I think it's up around 100,000 somewhere, and there would be a similar sort of percentage of the population would also in Australia have these terrible reactions that can actually kill them. Luckily, with Jane, she had a strong, healthy heart. She walks 5Ks a day, and the reaction, severe and all it was, could have been even more severe had it been a drug-drug interaction. It just lets us realise that we should never ever become complacent.